Hi, I'm Dr. Sean Cooney, and in this special edition of the Dental Minute, we'll go over the proper use of the water flosser. Alright, so a couple of things to know about the Waterpik WaterFlosser before we get started. First, tip safety. So when you insert your tip, you need to make sure that you push it in until you hear the click. Let me do that again. If you don't hear the click, it's not seated all the way, and when you go to turn the unit on, you could propel the tip somewhere, and depending on where you're aiming that, it could cause some damage. So just be aware of that. Second thing we need to know is tip angle. So you want to make sure the tip is at 90 degrees to the teeth. Angled this way, or this way, just isn't going to allow the water to be flushed into the proper places, and you won't be very efficient. Finally, power. The power with which the water is evacuated from the tip is dependent on this dial, and the dial goes from 1 all the way to 10. I would strongly recommend against using 10 or powers close to that, 8 or 9, just because you can do damage to your gums that way, and it's just not worth it. You can be plenty efficient with 4 to 6, which is the range that I find most people use. But whatever it is, you need to make sure you're comfortable using it. The best way to do that is to start off low, hold the tip in there, turn the dial up slowly until you feel that it's just right. Alright, so we're going to show you 2 methods today of how to use this water flosser. The first method is the method recommended by the manufacturer. I will show you that method with the general use floss tip. I will show you that method with the gum disease floss tip. All methods with the other tips that are included in this, the orthodontic tip and the bridge tip, are all used the same way as this general use tip. So once you learn how to use this, just apply that to those same tips and you'll be fine. The only tip that's different is this gum disease tip. Then we'll look at what we call the USC method, which is based on time and a study done by that university. We're going to start off with the manufacturer recommended technique using the general use tip. I'm going to turn the machine on. We'll show you how to use it. Alright, so you're going to take it, you're going to hold it behind the last tooth, and you're going to sweep the gum line, pause, 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 and you're going to keep doing that until you've done the entire cheek side of all of the top teeth. Once you're done with the cheek side, you're going to swing it around to the tongue side and you're going to go back to the start. Then you're going to move to the bottom and you're going to do the same thing. Start, outside, swing over, cheek side, and you're done. The manufacturer states that this should take you approximately 1 minute start to finish. Now if you have gum disease, you're going to want to do this method first, start to finish. Then you're going to want to switch out the tip for the gum tip. And I'll turn on the machine and we'll demonstrate how to use the gum tip. So you're going to take the gum tip and you're going to insert it into the gum pockets, down so that the tip is angled towards the root. And you're going to hold it there, pause, move to the next area. Now it's very important that you get this tip down in that area as far as it can go. Because if you don't get it down as far as it can go, you're not going to be flushing those deeper gum pockets. Just make sure that you ask your dentist or your hygienist where your gum pockets are so that you know where to use that tip. Okay, so now on to the quote USC method. So I've named it that based on a study that the University of Southern California did on the water flosser. Now, when you're flossing your whole mouth according to manufacturer recommendations, you are spending approximately 1 second per treatment area. The treatment area is basically the area where the Waterpik is touching. The study at USC found that in order to be effective, like the manufacturer wants you to be, they tell you you can get 99.9% of plaque off of your teeth with this. But in order to do that, 1 second just isn't enough. You've got to bump that up to 3 seconds, or so the study found, to become effective at getting that 99% of plaque off. So I'm going to switch tips back to the general use tip here, and I'll show you the USC method. So again, as with the manufacturer method, you're going to start at the back, you're going to move 1, 2, 3, move 1, 2, 3, sweep the gum 1, 2, 3, again 1, 2, and so on until you've completed the outside of the top arch. Again, you're going to repeat that on the tongue side, top and bottom, so that when you're done, outside, inside, top, and bottom have all been completed. So one final little hint. The manufacturer recommends that you put lukewarm water in the machine because they don't want you to have any sensitivity if your teeth are sensitive to cold or hot water, so they suggest lukewarm water. I prefer to use cold or hot water depending on which your teeth are less sensitive to, for one simple reason. When I've got, and I'll use cold water for mine, when I've got that tip in my mouth, I can feel the temperature of the water come through the space. So I hold my tongue up there, and when I feel cold come through the space, I know I flushed the area out enough. Now I need to spend that minimum 3-second time doing so, but if after 3 seconds I feel that water still coming through, then I go ahead and move on to the next area. If after 3 seconds I do not feel the cold water coming through, then I either need to change the angulation of my tip so that I'm passing water through in the proper direction, or I need to spend a little extra time. Maybe some food got caught in that space and it just needs extra time to flush out. So that's just an extra tip that you may use in order to make yourself a little bit more effective. So those are 2 ways to use the Waterpik WaterFlosser, and I hope you'd enjoyed these tutorials. Until next time, thanks for watching.